Okay, so recording. Okay, so this is a class on study habits and test taking strategies. So what I'm going to talk about are some test taking strategies at the end, but work on how in the best way that you should be studying and preparing for exams, and what are some of the techniques that promote deep learning, where you really get the content and the facts and concepts down into your deep memory, versus shallow learning, which is basically, and you've probably experienced this, you crammed the night before, you say, oh, I really have a grasp on this content, I really know it, I'm going into this feeling like I'm really prepared, and then you get to the first question and all of a sudden, poof, the information just kind of flies out of your brain, and you're going, I know this, I know, why can't I answer this question? And it's probably because by cramming the day before and not spacing your study out over several weeks, that everything was in your short-term memory, and once you went to bed that night and got up the next morning and went to take the test, your short-term memory, short-term, everything was gone. I'm going to go into the chat and see the code. You just go into your browser, and then this, once you get into joinpd.com, the code is MLARTC. Okay, so what we're going to talk about are some myths and legends about learning, things that you can do while you're reading for your class, things that you can do while you're reviewing or studying, things that you can do while you're taking notes, kind of some basics of how you should organize your study groups. And then we're going to talk a little bit about the NCLEX clinical judgment model, which is what the next generation NCLEX questions are built upon. And then NCLEX test taking strategies, practice questions. Okay, so there's some myths when it comes to learning. And myth number one is learning is fast. Learning is not fast. Don't try to read large volumes of reading at one time. Break it into smaller chunks. Your attention span, and I'm sure you've experienced this, even just reading a book for pleasure, you're turning pages and all of a sudden you realize, wait a minute, what happened here? I feel like I've, jumped ahead and I don't remember what I just read. Set a timetable for your reading and begin early in the semester. And that's why I wanted to do this little class at, early enough in the semester so you can just get off to a really good start. So when you get your reading assignments and you have the date for your first exam, check out the number of pages, divide it up over how many how many pages per day, and try to do a little bit each day. When it comes to assignments that you have with due dates, they take longer to complete than you think. So set up a calendar and set up what we call soft due dates. So if your assignment is due next Friday, put something in your calendar this Friday as a reminder to start working on that assignment, so that you don't wait till next Thursday and just look at, hey, what's my agenda for Friday? And like, oh my gosh, I have an assignment due tomorrow. And then you're scrambling around and you're basically giving away points when you do that kind of stuff. Myth number two is that learning is facts. Yes, we all have to know facts, and many of your exams in your prereqs were very fact-based. You memorized a bunch of facts. Once you're in nursing school and you start preparing for the NCLEX and your nursing practice, nursing is applying the facts that you've memorized, that you've learned, to situations. So flashcards, while they may have been very valuable for as a method of quizzing when you were just learning and trying to memorize facts, avoid using flashcards now. Now, what I consider flashcards are something that's basically a term on one side of the card and the definition on the other side. What some students, when I've talked to them and I say, don't use flashcards, and then they describe their flashcards to me, and they're really using, concepts, and they're analyzing and they're applying. So if you like note cards and you like having something to carry around to kind of quiz yourself or study off of, that's good. But don't rely on flashcards to memorize facts. Another thing is a lot of students like to use Quizlet. Quizlet questions are very, very fact-based. So they may be helpful in maybe Nursing 100 as you're learning some terminology, but don't rely on Quizlet as good, meaty practice questions as you progress through the program. So avoid mindless rereading of your notes or your textbook. If you're going to reread your notes, the best thing to do is to reorganize your notes. Take the notes that you've taken down in class and put them in a table or a concept map or a compare contrast grid, something that makes you rethink what you learned and not just reading over and over and over what you took down from your professor's lecture. And another myth is I'm good at multitasking. So a lot of students like to sit in front of the TV or have the radio or music on, and or a lot of activity going around. The distractions are going to prevent deep learning. If your mind is constantly switching back and forth between what you're reading and what you're studying and what's going on around you, the studying is going to suffer from that. So find a quiet room, close the door, turn off the TV, the radio, and just really focus. But don't focus for hours and hours. Your brain can't do that. Set a timer for 30 minutes and then take a 10-minute break. Get up, walk around, go out and yell at your kids to stop making noise. I used to, when I was in grad school, I had a sign on my door. Is the house burning down? Has somebody stopped breathing? Is somebody bleeding profusely? If not, don't disturb mom's studying. And sometimes, littler kids, those of you with littler kids, they're not going to be able to read the sign or even comply to that. But set a timer and take a break. Your brain needs a break when you're studying, because after a while, it's just going to go right in one eye and out the back of your head. Teach it to the wall. So when you're studying, stop what you're doing when you finish a certain area and try to recall it without looking at the notes or the textbook. Teach it to the wall. If you don't feel self-conscious, just write out loud, look at a picture on the wall, and try to describe that particular concept. If you can't do that, do a brain dump on a piece of paper. Just write down as much as you can remember about that concept or that content, and then check it against your notes and your textbook. And so what you were able to recall is in your memory. It's in a deep memory area. The things that you didn't recall that were important, those are the things you're going to need to focus on as you continue on it with your studying. Use the unit objectives and teach to a friend or a family member. If you can talk about it and answer their questions about it, then you've got a grasp of it. So all of your courses, you have unit objectives, you have course objectives. So every content area, there are certain things that if you can teach it to the wall, teach it to a friend or a relative, brain dump it onto a piece of paper, and you can regurgitate that and analyze it and apply it, then you know the information. Quiz yourself. You can generate questions that make you analyze, make connections. Now, Honan has chapter questions in PrepU. So if you bought a new book and not a used book, and you scratch off that QR code at the front of the book, and then you can create practice questions for each chapter on PrepU for that Honan textbook. ATI has a lot of practice assessments, and you can create dynamic quizzes for yourself. ATI also has a lot of really good active learning templates. When you land on your product page in My ATI, in the upper left-hand corner, there's a link for the online review modules, and there's a link for the active learning templates. Create a concept map. And when you are able to link all the different aspects of a particular concept, then it really gets into your brain. If you like to highlight, I used to love to highlight. I highlighted so much that everything was highlighted. And then I'd go back to the textbook and say, okay, I'm just basically rereading the textbook. So highlighting is an art, and less is more with highlighting. So when you're highlighting, you need to read the chapter or the section of the chapter first without doing any highlighting, and then go back and pick out the key distinctions, the connections, the applications. Now, in textbooks, your textbook authors will do bolded things and italicized things, which may jump out at you, but they might not really be the core concept that you need to remember for the course. So start to make connections while you're highlighting. So highlighting is really a long process to do it correctly. You have to do multiple readings, you have to make thoughtful decisions, and then once you've highlighted, you have to remember that you have to go back and actually read the highlights. If you're not going to do that, then you're distracting yourself as you're highlighting and you're not really absorbing what you're reading. That's why I don't highlight anymore. Now, there's some techniques that are really good study habits to help you be able to understand what you've read. One of the questions that you want to do is ask yourself, how does this concept relate to other concepts or my prior knowledge? So when you're studying a particular disease process, you need to be thinking back to anatomy and physiology, where you learned the normal function of the kidneys and the normal function of the lungs and what that normal function is supposed to look like. And then you put it and apply that to the concept that you're learning, the disease process, for example, that you're learning. So some of the ways that you can do elaboration to help really get that information into your brain is do compare contrast grids. I actually have a few of those that I do in Nursing 220, where I've handed them out to the students and say, look, do a comparison of acute respiratory failure and how is that similar to and different from acute respiratory distress syndrome. You can do concept maps. Now, I'm not a very visual person. I'm more of the compare contrast person. I don't look in pictures, but many people love concept maps because it's a very visual picture. And then as the opposite of elaboration, you've got distinction. How is this concept different from other concepts and prior knowledge? And that's really going to help you differentiate when you get into certain areas of study throughout your coursework. I know some of you are in Nursing 200, and you're going to be doing endocrine. So there's hyperthyroid, hypothyroid. Well, what's similar? What's different? That can help you differentiate your different, and your Nursing 110 students, you're doing fluid and electrolytes, hypernatremia, hyponatremia. So do compare contrast grids, concept maps in those ways as well. Ask yourself, how am I going to be expected to use this information by my instructor? And the further along you get into the program, the more we're going to expect you to analyze and apply what you've learned to clinical scenarios and situations, because that's what the NCLEX does, and that's what your life as a nurse is going to be. Getting report, listening to a clinical scenario, and figuring out what you're going to do about it. So some good tools are case studies, practice questions on ATI and PrepU, and Chat GPT, the AI. However, what I just learned from a nurse educator Facebook page I'm a part of is that Chat GPT will no longer allow you to create questions and scenarios that are medically related. I guess, because they're, Chat GPT, these AI um, products are not 100% accurate. In fact, a lot of instructors are having students create scenarios with Chat GPT and then spend time in class analyzing how they're incorrect, including some of the references that don't even exist that Chat GPT will put in there. So you might be able to do some types of questions on Chat GPT, but I have heard that they're reducing significantly the amount of medically related information that they will generate for you. Now, when you are studying, there's a process of studying that is very beneficial to get it into your brain and keep it there, and that's something called interleaving. So you should be already starting to study and review the material that you learned last week in your first week of class as you are preparing for what you learned, what you had to learn this week. And so you should alternate between the topics and the chapters in the units within one study session, so that your brain doesn't start to fog up where you're focusing just on respiratory or just on nursing process. Well, let's get a little bit more into vital signs and things like that for Nursing 100. So alternate, and that keeps your brain fresh. Mix it up, review things in a different order. Just keep it going so your brain doesn't get bored. And remember, take breaks while you're studying. 30 minutes, 45 minutes max, and then take a 10-minute break just to clear your head. Now, taking notes. Taking notes in class is very, very difficult. I actually take notes when I'm sitting in church listening to the sermon on Sunday morning to practice taking notes the way my students should take notes, which is writing down key points instead of every single word that your professor is saying. You will have carpal tunnel syndrome by the end of your first class if you try to do that. And while you are trying to write down one thing that they said, you've missed 5 other things that they've said. So write down key points. And if you've prepared for class and you've read the material, so you've got some of it in your brain, then you're not going to feel the necessity to write it down because you already know some of it. If you don't prepare for class, then the information is going to be overwhelming for you. Create memory cues in your notes afterwards to kind of maybe link different concepts together. If you've missed something and you have a question, ask the professor right away, shoot them an email if there's no time after class. Check with one of your friends to see what they took down, but you got to be careful because they may have taken down the wrong information. So you should always verify it. It's okay to record the class. A lot of my students record my lectures and then they can kind of take maybe little bits of notes, but then really focus on note taking on something where they've recorded it and they can pause and rewind and things like that. If you don't, everybody's got messy handwriting when they're trying to write their notes. I can barely read mine when I do them. But when you're rewriting your notes, don't just rewrite them, reorganize them. Again, put them into charts and grids or compare contrast or concept surrounding a concept. Otherwise, you're just copying over. There is benefit to copying over just because of that brain-hand connection that happens, but reorganizing them really helps you to get those concepts in an organized manner. If you have a study group, and I highly recommend study groups if you can do them, but you have to make sure that your study group is not a social occasion. You should have an agenda and stick to it. So if you're reviewing respiratory for the first exam, then say, okay, Sally, you take these pages or concept or section or unit outcome or whatever, and somebody else takes another, and you all come prepared with points to share or practice questions to quiz each other and things like that. Take breaks, but when you are in that study group, have an agenda and stick to it. Run it like a business meeting, not a social occasion. So any questions about study, anything that I need to clarify for you? Throw them out at me now, and then we'll get into the NCLEX practice.
I do have a question.
Sure.
So when reading material, I tend to pause the material and then write notes. Would you
Mhm.
suggest reading through the material first, then going back and writing notes? Because I find myself taking a longer time to go over the material.
Yeah, I would say just like with highlighting, if you're not highlighting the book, if you're taking like bullet points kind of or outlining, is that what you're saying?
Yes.
Yeah, definitely read an entire section, maybe not the whole chapter because that's, in the Honan book, that's quite a bit. But,
Mm-hmm.
read a particular section where you've got a logical dropping off, ending off point,
Mm-hmm.
and then go back and kind of look at, because I find really with the textbooks, there's a lot of need to know. There is need to know information. There's a lot of nice to know information. And if you have a version of like a student version PowerPoint that your professor has posted and they reference any tables, definitely check those out. They have in the Honan book, they have little, nursing alerts and things like that. So focus on tables and charts and nursing alerts, and then go into the actual body of the textbook and find some key points to jot down.
Okay.
Because if you try to take, because when you're reading, it's like, oh, that's so interesting. That must be important.
Mm-hmm.
Sometimes it is, sometimes it's again nice to know. And if you're one of these people, that there are people that really like to get really way deep down into the pathophysiology, like they're going to become a doctor,
Mm-hmm.
because they feel that helps them understand what the nurse needs to know. And I don't fault that. If that's how you learn, that's great. But don't get hung up and feel like you need to know the deep down pathophysiology, because your professor is going to focus on your need to know as it relates to that disease process.
Okay, that was very helpful. Thank you.
Great. Any other questions?
I found myself that the PowerPoints has little information,
Mm-hmm.
and I end up reading the book like over and over and over, which I don't understand the information from the PowerPoint to the book, which I think there is like about three books you have to read from. What
Now,
is your
what
takeout
course are
from
you in?
studying from that?
What course are you in, Paula?
100.
100. So you've got the open education, those fundamentals books that you're
Right.
using. Right.
Yeah.
So the PowerPoints really are kind of like the skeleton of an outline. So they're
Okay.
basically prompts and questions on where you need to focus. So what I would say, because it's really hard to kind of get a grasp right the first week of class of where your professor might be wanting to focus on,
Okay.
that if you write as you're reading and you look at the PowerPoints, if you write down just a few little bullet points or concepts
Mhm.
for each slide, so that it will be there to kind of jog your memory when you get into class. And then
Okay.
when she starts talking about what are the key points that are important, that's what she's going to cover in class. Now you've got the bare bones on those PowerPoints and you can fill them in with
Okay.
notes during class.
Uh,
Did that help? Oh, I can't hear.
it's just that I have to read from three books of football. Like I am reading from all the books.
Yeah, it's really, there's a lot of material, and I know in Nursing 100 it's overwhelming. Just, keep plugging away at it, write down a few little highlights onto your notes as you're reading, and then pick up the rest of that information when you get to class. Are there any other questions? Okay. All right, so we're going to talk now about the clinical judgment model, or you'll hear it called the CJMM, the clinical judgment management model. And this is the basis for next generation NCLEX. One of the other professors, the Michelle Moeller, who used to be the Nursing 200 coordinator before Professor Fries took over the job. And now Michelle does, I believe, Nursing 100 clinicals, and she does academic tutoring. Fabulous, fabulous resource for you. But we were so excited when we were sitting in on a webinar with the National Council State Boards of Nursing, NCSBN, who are the ones who dictate what is going to be on NCLEX, your licensure exam. And they started talking about the Lassiter clinical judgment rubric. And if you pull out your clinical evaluation tool that you're going to be using throughout the entire program, at the very end of that tool is the Lassiter clinical judgment rubric, which we have been using in the Goodwin Nursing program for about 10 years, maybe more, as our clinical evaluation tool. So Michelle and I, Professor Moeller and I, were very, very excited when we saw that that is what the new NCLEX is based on. So you will be very, very familiar with a lot of the terminology that comes on next generation NCLEX. So it's very similar to the nursing process, which you've all learned about, or those in 100 will learn about. And so it starts off with recognizing cues, and I like to call those the red flags. So when you're reading an NCLEX question and you're looking at a clinical scenario, or you're looking at what they call an exhibit format, where they have different tabs on the question, and one tab is for the diagnostic tests, and one is for the labs, and one is for the nursing notes, and you're tabbing through and you're looking at all this clinical data. What you're doing is you're looking for red flags, the things that are jumping out at you as being problematic. And so as you go through the program, you're going to recognize those red flags are going to jump out at you more strongly, the more knowledge that you've developed. And so once you've identified those red flags, then you go to the analyzing the cues, and you're asking yourself, well, what do these mean? And so what they'll ask you on the NCLEX is, based on, these cues, what do you think is going on with this patient? What do you think is the problem here? That's where you're analyzing your cues. And then you have to prioritize. And prioritizing is something that we're going to be talking a lot about throughout the program, is trying to decide what's the most important cue that you're going to be addressing. Is it airway or breathing or circulation, which is a very common way of prioritizing? So you're going to be asked, what is the most important? So as you develop your clinical judgment, you're going to be better able to look at some red flags that you can kind of dismiss as being not important or not life-threatening for the patient. And you're going to be able to recognize which ones are really life-threatening and are your biggest concern for that patient. Then you're going to generate solutions. Okay, what needs to change? What do I have to do, or what has to happen to the patient to get them back to a normal status, to get them on the road to healing from this particular problem? So what basically the solutions are kind of your goals from the nursing process. Where do I want this patient to be? If their, respiratory rate is in the 30s, and that they should be in, in the mid-teens, then my solution is going to be, I want this patient's respiratory rate to get down in, to be below 20. And that's my goal. And then take action. And that's obviously your implementation phase of the nursing process. So what are you going to do about these cues to get to that solution or goal? And then evaluate the outcomes. And that's basically, did it work or did it not work? And if it didn't work, then what do I need to do to change my plan of care so that the patient will continue on a better, more positive track? So this is your clinical judgment model. Recognize that you're going to see these terms like cues and hypotheses in your NCLEX style questions. Yes, somebody have a question? Or did they unmute? Question? No, okay. Okay, so let us look at some test taking strategies. So one of the strategies is don't read beyond the circumstances. On an NCLEX question, what you see is what you get. Take the words what if out of your vocabulary. When you see the description of that patient, don't say, well, what if they also have diabetes? Or what if they also have COPD? Or what if they also have gastric reflux? No, if it's not in the question, it's not there. Read every word in the question and try to determine which direction that sick, twisted person who wrote that question, because those people who sit and write NCLEX questions have a little sick and twisted. So let's do a practice question. So what you'll do is on your PD browser, you're going to choose the number for the answer, and then I can look and see what the average answer was. So we have a client with metastatic cancer receiving a continuous IV infusion of morphine sulfate to alleviate pain. Select the adverse effect or sign of toxicity for which the nurse monitors the client: dizziness, nausea, skeletal muscle flaccidity, or sedation. Okay, so I got a little bit of a variety here. And so what we're going to do is we're going to look at this question. When you're reading a question, you need to pick out the key words that are telling you what they're really asking you. And right here, they are not asking you for side effects of morphine. They're asking you for adverse effects or signs of toxicity. So the extreme worst case, what can happen for somebody who is maybe hypersensitive to morphine or got too much morphine. So you would expect dizziness. That's a side effect when somebody gets morphine. They may get a little lightheaded. And because of that dizziness, they may feel a little nauseous. And they may be very sedated. I've pushed morphine on a patient, and you have to push it very slowly, IV, and have them fall asleep before I even finish pushing the entire dose. So, but what you don't expect to see as a side effect is skeletal muscle flaccidity. That is a sign of toxicity. If the patient's laying there all floppy in bed with no muscle tone, that's bad. That's an adverse effect. So number 3 would be the correct answer in this one. So strategy 2, again, looking for keywords. Keywords could be things like, what is the best thing to do in this situation? What is the first thing to do in this situation? What's your priority? What's the least appropriate, most appropriate, that sort of thing. So the nurse is caring for the client who has just returned from the recovery room after undergoing abdominal surgery. Select the early sign of hypovolemic shock for which the nurse monitors the client: decreased deep tendon reflexes, increased pulse rate, increased depth of respiration, lethargy. Okay, so we've got a lot of different things here. So the key word here is early. And when you get to 220 and you have the unit on shock, you're going to learn there's stages of shock. There's certain signs and symptoms that are very early signs that somebody is going into shock versus things that might be demonstrated when they're fully into that whole process. So the first thing that's going to happen is their heart rate is going to increase, because with shock, you're not getting enough oxygen to your cells and tissues and organs. And the first thing your body does to compensate is to increase the heart rate to try to get more oxygenated blood where it needs to go. So increased heart rate is your early sign. A later sign would be something like the lethargy or the decreased deep tendon reflexes. And somebody's mic is on. If you could make sure that you're muted, please. Guidelines to prioritizing. So ABCs, airway, breathing, circulation, almost always your first priority. And I say almost because if the person in the scenario does not have an airway, breathing, or circulation problem, like say, for instance, they fractured their ankle and there's nothing in the question that says they've got a breathing issue, then airway isn't going to be your first choice. And the sick, twisted people who write these questions, they know you've had ABCs drummed into you from day one of nursing school. So they'll throw a breathing or an airway option in there to distract you. And you land on that because you have ABCs running through your head. So always look at the scenario to see if airway is your first priority. Most of the time it is, but just to be sure. Maslow's hierarchy of needs, which I'm sure you all learned about in psychology. Physiological needs are always going to take priority over things like psychosocial. So yes, you are concerned about the depression and anxiety and agitation that your patient is experiencing, but you need to focus on their physiological situation first. You can prioritize in the order of the nursing process. So what's the first step of the nursing process? Assessment. It's always best to gather more data first before you start jumping in and doing something on that NCLEX question. And we'll talk about things that might be an exception to that in a little bit. Systemic before local. So life-threatening issues are going to be more important than something more peripheral, not life-threatening. Knowing what the chronic state is for a disease process is very important, because sometimes you'll get a scenario where somebody has a chronic condition and you're looking at the labs and they're out of whack, and you're listening to their lungs and they don't sound too good, or you're looking at their ABGs and they're not good, but that could be their baseline chronic state. But what's happening when they go into an acute decompensation or an acute exacerbation? That's when the red flags start coming out. You're looking at the actual risks and things that could happen to your patient versus what might happen. Focus on the actual things that are actually happening rather than things that might happen down the road. Yeah, you're going to have those kind of on the periphery of your radar, but focus on what's actually going on with your patient. Focus on trends versus transient findings. So many NCLEX questions are going to give you a lab exhibit or a vital sign exhibit where they'll show the different changes in the vital signs or the lab values or the physical assessment over time, so that you shouldn't be focusing on one recording of a heart rate that might be out of whack, but is their heart rate gradually getting faster and faster and faster, or is their blood pressure gradually going down and down and down versus one little dip and then back up to baseline? Signs and symptoms of emergencies and complications versus the expected findings. So that kind of goes back to your acute versus chronic. And then look at the time that has elapsed. The most recent situation, like the most recent admission, exacerbation, surgical procedure, is going to be the most critical, the most unstable. So if you're comparing somebody who had a heart attack today versus somebody who had a heart attack last week, the most critical one is the one that had the heart attack today. So another question, what's the priority intervention for the patient experiencing chest pain and a pulse oximetry of 86? Administer morphine, administer oxygen, administer nitro, obtain an EKG. All righty. Administer oxygen. So some might want to focus on the chest pain because pain is our fifth vital sign, but you know that your pulse ox should be greater than 95%. So if they're way down below 86%, then you need to be focusing on that. A client with cancer is receiving morphine sulfate 10 milligrams sub-Q every 3 to 4 hours for pain. Select the priority action that the nurse includes when preparing the plan of care for the client. Encourage fluid intake, encourage the client to cough and deep breathe, monitor stools, monitor urine output. Oh, we got all kinds of good stuff happening here. All righty, let's look. Okay, so all of these are going to be part of your plan of care. But what's your priority? Yeah, you're going to encourage fluid intake because they can get dehydrated. You're going to monitor their stools because they're going to get constipated. You're going to monitor their urine output because you want to make sure they're peeing, they're not having any urinary retention. But what is it that we know about morphine? It depresses respirations. So encourage the client to cough and deep breathe is your priority. It's an airway option, and you know that morphine depresses respirations, so that is your priority. A different medication could potentially not really care about coughing and deep breathing and not be a problem with that patient. So here the airway one is the priority. A 19-year-old patient presents with acute asthma, respiratory rate of 44, respiratory distress. What's your priority action? Conduct a respiratory assessment, administer bronchodilator via nebulizer, apply a cardiac monitor, provide emotional support. Okay, so remember how I said assess first? In this case, we have an emergency situation. So gathering more data could potentially put that patient at risk. In this case, you're going to jump in and do something to open the airway. So sometimes, most cases, you're going to have to gather more data. That's going to be your first choice. But when you have an emergency, like you have in this scenario, gathering more data could put the patient at risk. Now you have to jump in and do something. You need to understand the principles of physiologic response and then interpret the data. So this is where your knowledge of anatomy and physiology and how well you learned it in your A&P courses is going to be very helpful because you've learned what the normal is. And then now that you're in nursing school, you're going to be learning what the abnormal is. And so you have to do that compare contrast. You've got to see, what do I expect to see in this particular lab value when it comes to a kidney disease versus somebody that has kidney, renal insufficiency, and the lab is going to look like this. So you have to think critically and determine the rationale for the interventions that are presented. So look at the selected data, figure out if it's correct, if it's normal or out of range, and you can be very, very happy that you are now nursing students at the time when the NCLEX decided to include the normal reference ranges for all of the labs in all of the NCLEX questions. So you no longer have to memorize all of those labs that you learned in nursing school. So we were so thrilled to hear that, because really, realistically, if you're in practice and a lab is drawn that you're not really familiar with, you're going to look it up. And then the report that comes from your lab is going to give you the normal reference range so that you can look at it and see whether it's high or low. And they're even telling you on the lab report it is high or low. So the important part is knowing what to do about it when that lab is abnormal. So I'm glad they finally came into the 21st century with that. Now we're going to kind of tear apart this question of the lab results with an ABG, and I put your normal range here because obviously you will get this on the NCLEX. So the nurse is reviewing lab results from an infant with hypertrophic pyloric stenosis. Select the lab finding the nurse would expect to note in this infant. So here's your normal, and here are the ones that you're going to decide, hopefully, what you think that you might see in the lab values. A pH of 7.3, a bicarb of 19, a pH of 7.5, or a PaCO2 of 35. And if you're struggling with it, just kind of give an answer and we'll tear this apart so that you can see how you can break these things down if you don't know what hypertrophic pyloric stenosis is, for example. Which, if you haven't had PD and OB yet, then you probably don't, unless you know of a baby and are familiar with this particular condition. Okay, so we've got a bunch of different readings here, and let's look at what is happening with this baby. So I'm assuming that you may not know what hypertrophic pyloric stenosis is. And this can come up on an NCLEX question. You get something that's there and you say, oh my gosh, I've never seen that before. But don't panic, because the NCLEX is a computer adaptive test. And you can't, if you skip an answer, or you just do what I call a WAG, a wild ass guess, coin toss, however, or I'll pick C because that's what everybody has said. If you don't know on a multiple choice question what the answer is, pick C. I mean, you hear all these weird things. Don't do that, because you need to prove to that computer that you know your stuff when you're taking the NCLEX. And if you skip a question, then they start dropping you down that confidence line. So normal pH, 7.35 to 7.45. So if you have a pH below 7.35, you are in acidosis. If it's above 7.45, then you are in alkalosis. So let's look at hypertrophic pyloric stenosis. So hypertrophic is a term, a descriptive term. It's hyper is, increased. Trophic, it's like swollen, and it's kind of oversized. Pyloric is a sphincter in the stomach, and it is at the base of the stomach. So it's supposed to open up and let food go from the stomach into the small intestine. And stenosis is a stiffening or narrowing. So what you have here is a baby with an enlarged, swollen, stiffened, and narrowed pyloric sphincter, which will not allow the food that the baby is taking in, the formula or the breast milk, to go from the stomach down into the small intestine. It just keeps filling up the stomach and filling up the stomach. And eventually it's got to go somewhere. And what happens is it comes out in projectile vomiting, which will basically can literally hit the wall across the room. It is quite dramatic. And when you are having profuse vomiting, you are not only losing what was in your stomach in way of food, in this case, formula or breast milk, but you're also losing gastric acid. And when you lose acid, you go into alkalosis. So what you would expect is a pH of 7.5. So implementation, you have to focus on nursing actions versus medical actions. So if there is an order for XYZ, you as the nurse cannot change that order. You can call the doctor and get a change, but you can't tell the patient, oh, the doctor says that, you need to take this medicine before breakfast, but it's upsetting your stomach. So I'm going to tell you, you can take it with breakfast. No. The doctor says they have to take it before breakfast. You can't change that. You focus only on the client that's in the question and answer as if this person is your only client. That is not reality. That is NCLEX land. You answer from the textbook perfect point of view, which means it's whatever the signs and symptoms that you have learned about a particular disease process, that's what it's going to base the question on. Not the fact that your grandmother had this condition and she had this kind of outlier, weird sign or symptom. And so you associate that with that disease process, but it's not a typical sign or symptom. So you need to know the textbook. And then in NCLEX land, when you have a question that's having you decide, what do I do first? You are the only nurse in the room. You have to do everything in the question, and you can only do one thing at a time because they're testing on whether or not you can prioritize what's the most important task that has to be done. In real life, in most of these NCLEX questions, there will be multiple people in the room doing all these things simultaneously. But in NCLEX land, you're the only nurse in the room. You have to do everything that's in the question. You can only do one at a time. So what is the first thing that you're going to do? The nurse is caring for the client with angina who begins to experience chest pain. The nurse administers a sublingual nitroglycerin tablet as prescribed, but the pain is unrelieved. Select the action the nurse should take next. Call the family, reposition the client, administer another nitro, call the doctor. Okay, so this question is going to be based on your prior knowledge about how nitro, sublingual nitro, is ordered for patients who have angina, which some of you may have learned already and others haven't gotten to that content yet. But sublingual nitro is usually ordered as like this, 0.4 milligrams, sublingual, PRN chest pain, Q5 minutes, every 5 minutes times 3. So that's kind of the standard when the patients get a prescription for nitroglycerin and they have chest pain. They take one, they wait 5 minutes. If the chest pain is unrelieved, they take another. They wait 5 minutes. If the chest pain is unrelieved, they take a third. So they can get up to 3. Now, when I did home care, that was my area of practice before I became faculty. My home care patients, I would tell them once they took the first nitro, call 911, because by the time they take the second and then the third and they're not working and then they wait to call 911, if they happen to be having a heart attack, they may not make it until the ambulance gets there. So calling the client's family is not going to be what we need. We're not going to call the physician yet, which I know most of you answered. We're going to give them another nitro. And how we know that we can give another nitro, because you know they can get up to 3 every 5 minutes. They begin to experience chest pain. So we know that it just started. We're not reading into this question. We're not putting information into it. We know that they just started it because they begin to experience chest pain, and the nurse administers a sublingual nitro as prescribed. So you know they just started the chest pain and they just got 1 nitro. So you can give them another nitro after 5 minutes. So 3 is your correct answer. Determine if it's a true option or a false option. So true options are like the types of questions that you're used to having. You know, they give a scenario and there's 4 options and they relate positively to that question. False options are the kinds of questions that are asking you to pick the wrong statement by the patient or action by the patient, because that will be the correct answer. And usually the question is worded like, you've done teaching on XYZ. What statement by the patient indicates the need for further instruction? So you have to pick an incorrect statement by the patient, and that will be the correct answer to the question. But after a while, as you're trying to do that question, your brain is flipping back and forth, trying to figure out where, you know, what you should be looking at. So let's do one of these and kind of talk through it. So the patient has an order for a vest restraint from 10 p.m. to 7 a.m. because he's confused and tries to get out of bed. What observation by the charge nurse at 11 p.m. indicates the patient's nurse has performed an unsafe action? So that last phrase is telling you this is a false option question. So basically what you're having to figure out is what is an unsafe action. So the best way to do this to keep your brain from flipping around and getting confused is to read the question, determine it's a false option question, and then read every option that is presented to you and say, is this, in this case, a safe action, true or false? And so you will mark the options as either true or false as to whether or not it's a safe action. And then the false option will be the answer to the question. So in this case, is it true? Is it safe that we have a safety knot to secure the vest? Yes, that's true. Is it safe that the record says release the restraint every 2 hours? Yes, that's the protocol with restraints. Is it true? Is it safe that the restraint is applied tightly? That's false. So you mark that false. Is it safe that you have the call light in reach of the client? Yes, that's safe. So we've done true, true, false, and then true. So the false option is the restraint was applied tightly. That's the answer to your question. Therapeutic communication. Many questions will say the patient says XYZ. What is your most appropriate response? So let's answer this question. I'm afraid my child will have another seizure. Select the most therapeutic response for the nurse to give the woman. Please tell me why you're concerned. Most children will never experience a second seizure. Tell me what frightens you most about the seizures. Acetaminophen can prevent another seizure. Okay, so we're kind of half and half. Oh no, somebody changed their answers. See, on the NCLEX, you can't change your answers. Tell me what frightens you most about the seizure. Okay. This number 1 is kind of like, you're kind of getting at the same thing as you are with number 3, but very important. In therapeutic communication, you don't ask why. You never ask why. because that will put the person on the defensive or may make you appear confrontational. Now, you know that in normal conversation with people, you can ask why questions at certain points in the conversation, and it's not challenging or confrontational. But with therapeutic communication, if they are asking you and there's an option that says why, but it sounds really good, don't get dragged into that. Tell me what frightens you most. Tell me more. That's a good rule of thumb when you're doing therapeutic communication. Tell me more. So 3 is the correct. Eliminate the similar, pick the one that's different. So you don't have a clue. You're looking at the question and going, oh my goodness, what am I going to do? Sometimes 3 of the answers will be so similar that you really can't prioritize using those methods of prioritization. So just pick the one that's different. It'll give you a fighting chance. Oral levothyroxine, 50 micrograms daily, prescribed for the client with hypothyroidism. Select the time at which the nurse tells the client to take the medication. Just after breakfast, with a snack, before breakfast, after supper. So we got after breakfast, we got an after supper, we got it before breakfast. So if you've had to give thyroid Synthroid to someone or you take it yourself, you know that you're supposed to take it on an empty stomach. But if you don't know that, the way that you can do this is just eliminate the ones that involve food and pick the one that's an empty stomach. So just after breakfast, you got food in your stomach. With a snack, you got food. After supper, you got food. But before breakfast, empty stomach. So this eliminate the similar, pick the one that's different. Eliminate absolutes. If an option contains an absolute like all or always or never or only, it will tend to make that option incorrect because there are no absolutes in life and medicine and everything like that. You can look for an umbrella or global option. So maybe all of the options seem very similar and you again can't prioritize what's the best answer. Look for one that contains a more broad, overarching kind of statement that maybe includes all of the concepts in the other options that you're also considering, and go for the umbrella or global option. The nurse understands the overall aim of therapy for a client with cerebral palsy is to improve muscle control and coordination, to correct the underlying cause of the disease, to prevent contractures and emotional disturbances, to maximize the client's assets and minimize limitations. So what's your best answer here? Okay, so basically, yes, you are going to want to improve muscle control and coordination. That's a good option. You have to eliminate number 2 because you can't correct the underlying cause. This is a congenital issue. Prevent contractures and emotional disturbances. Yep, you want to do that. So how do you decide between the 2? Well, you go to number 4, maximize assets, minimize limitations, a more global, broad statement that encompasses number 3 and number 1. Use delegation guidelines, and you're going to learn a lot about the scope of practice of the RN versus the LPN versus the UAP, the unlicensed assistive personnel, which are your nurses' aides, home care aides, patient care techs, that sort of thing. The RN is responsible for the nursing process, assessment, initial teaching, formulating the care plan, setting up the teaching plan, Evaluating the effectiveness of the care plan, those you cannot delegate to the LPN. The LPN can gather data, which is basically assessment, but they don't associate the word assessment with LPNs because assessment is the RN scope of practice. Data collection is the LPN scope of practice. So once the RN has assessed the patient, they can delegate gathering data, which includes assessment data using the same assessment techniques that the RN uses, lung sounds, that sort of thing. But they are contributing data to the care plan that the RN is overseeing. In most states, in all states, LPNs can do oral medication, sublingual, sub-Q, like insulin or heparin, IM injection, intramuscular injections, but some states restrict LPNs when it comes to IVs. So most states now allow LPNs to take care of patients who have IVs, but they may prohibit, some states may prohibit them starting IVs or hanging piggybacks onto an existing IV or pushing IV meds. So when you're on an NCLEX question, the questions are normed for the most restrictive regulations across the country. So it is always safe to not delegate to the LPN things like blood products, initiating IV antibiotics, and starting IVs or any kind of piggyback medications. UAPs are going to do the custodial activities of daily living, the instrumental activities of daily living, and they may be able to do some invasive things like a finger stick blood sugar or things like that, which they're specially trained for, to do that. The patient has chronic obstructive pulmonary disease. Which intervention for airway management should you delegate to a nursing assistant or PCT? Assist the patient to sit up on the side of the bed, instruct the patient to cough effectively, teaching the patient to use incentive spirometry, auscultating breath sounds every 4 hours. Correct. Assisting the patient to sit up on the side of the bed. Instructing, the RN has to do that. Teaching, the RN has to do that. And then the LPN can follow up and reinforce the teaching after the initial teaching is done. The RN or the LPN can auscultate the breath sounds every 4 hours, but the PCT cannot. Select all that apply questions. So the crazy thing about NCLEX, it was something that they changed a few years ago, is that it can be, if you have a select all that apply question, it can be one of the options will apply and only one. All of them could apply, or any number in between. So there will be at least one that applies, and it could be up to and including all of them. So you don't even have the luxury of looking at one of the options that you say, not too sure about that. Should I pick it? Should I not? But if everything else applied, then you always felt that it was safe to not check that one you were a little question about. Now it could be there. It could be included. So you can use a true false strategy when you're doing select all that apply questions. One of the good things on the new NCLEX is that some of the select all that apply, they will give you 8 options and they'll say, select the top 4 priority, which is nice because okay, I have to pick 4. So I don't have to question whether that 5th one really fits. So let's do a true and false on this. We have a patient, the client's having difficulty with motor aspects of speech, difficulty forming words, has a nasal tone. Select all the communication strategies the nurse would use when working with this client. So with select all that apply, the best strategy is to read the question, make sure you understand what it's asking you, and then go to the first option and say, is this true or false? as it relates to the question. And that's a very important part of it, as it relates to the question, because it could be a true statement for another situation, but a false statement for this one. So it always has to fit that scenario. So would you repeat what the client said to verify the message? True, because they're having difficulty forming words and communicating with you. So you want to make sure that you're getting what they're saying and that they know that you understand. Would you encourage the client to speak quickly? No, because they're having difficulty speaking. That would not be helpful for them. So B would be false. Would you nod continuously while the client is speaking? That would be false. You've got an absolute here, continuously. And think about it, if somebody's just nodding at you all the time that you're talking to them, can be very distracting. So that's a false one. Engage the client in lengthy discussions to strengthen the voice. That is false because they're having difficulty talking. You don't want them to have to talk a lot. Ask questions requiring a yes or no response. This is true. Now, when you learn about therapeutic communication, you've always learned, always ask open-ended questions. Don't ask yes or no. You'll get more out of the person that you're questioning if you ask open-ended questions. But in this case, this is something that you would want to do because you don't want to overexert that patient who's having difficulty speaking. So in this case, asking questions requiring a yes or no response is true. And then use a letter board or picture board. Yes. So if they're not able to articulate what they're trying to say, they might be able to point at pictures or letters in order to communicate. So the true aspects, the select all that apply, would be A, E, and F. The nurse is assessing for peripheral neurovascular dysfunction after knee surgery. What parameters should the nurse assess and document? Select all that apply. So what you're looking for here is peripheral neurovascular dysfunction. So your circulation, motion, sensation that you're going to do on all of your orthopedic patients or anybody who has an injury to make sure that they have good circulation to all their entire extremity, make sure that they have good sensation, there's no numbness and tingling, that sort of thing. So ways that you would check for peripheral neurovascular dysfunction would be looking at the color of the patient's lower leg and foot. True. The ability to move the foot. True. Sensation in the foot and lower leg. True. Temperature of the foot and lower leg. True. So is it nice and warm? If it's cold, you got a problem. The presence or absence of hair on his lower leg. That is
No.
false. That is not part of your neurovascular dysfunction, because that would be the consequence of someone who has long-term peripheral arterial disease. So it's not part of assessing your circulation, motion, and sensation. So E would be the only one that you would not select here. Changing answers. I know all of you at one time or another has changed an answer and changed it to the wrong answer. Occasionally you might change it to the correct answer, but very rare. Change your answer only with confidence, not with doubt. If you have read the question carefully, you've looked at all the responses carefully, and you decided on one that looked the best and made the most sense, trust your gut, have confidence in your ability to analyze the situation, select it, and move on. For the first part of the program, you're going to be able to go back and review your exam before you submit it. At a certain point, I believe around the middle of Nursing 200, everything is going to be forward only. So you can't go back and change your answers. And you can't go back and change your answers on the NCLEX. Once you click submit on that question, it goes into the ozone and you'll never get a chance to answer it again. So just read your questions carefully. Make sure you've read all the options. Don't just look at the one that jumps out at you that looks really good. Make sure it fits and just don't change your answers. Just don't do it. Cover your answers. Now, you might be one of those people like me who would start to read the question, thought they knew where the question was going, didn't finish reading the question, jumped down to look at the answers. And one of the answers jumped out at me that looked really good because it had all the buzzwords that the professor was talking about in class. And it just looked really good. Looked really, really good. But then you remember, oh, wait a minute, I didn't read the full question. Now you go back and read the question because you've got that answer in your brain as what you think is the right answer. And your brain will change the meaning of the question to fit the answer that you picked, that you fell in love with. Not a good thing. If that is something that you do, to remind yourself to read every single word in the question, because sometimes you miss keywords like not and except that totally change the meaning of the question. Take your scrap paper, cover up the answers on the computer, read the question as completely and see if you can formulate a possible answer to the question, then uncover your answers, and probably the answer will be there that you thought of. So if that is you, and I see a couple of people every semester that are still covering up their answers with their scrap paper when they're taking tests, when I'm proctoring exams. So do it. If that's you, train yourself to read that question thoroughly before you look at those answers. Focus on the name of the medication because NCLEX only gives generic names, which this is what you'll be using because all the Pyxis or Pixi or whatever you want to do, the plural of the Pyxis, is going to give you generic names as well. Those of us old fogies that learned all the trade names and some of the generic names got really confused, but now you're not really learning them. Anyway, so the client should never adjust or change the dose or stop abruptly. So that will be maybe in a false option question, something that the client says after you've done teaching. You cannot recommend even over-the-counter medications unless it's cleared by the MD. So that if you are an advice nurse at a doctor's office, you will have standards and protocols of things that you can recommend, but that's because the doctor is telling you you can recommend it. It is the doctor's order. You're never going to give the med when the order is difficult to read, unclear, or an abnormal dose. And if you are in a facility that has a pharmacy that's filling the meds, the pharmacist will kick that, won't even supply it anyway. But you may work in a facility where you have to go into a drug cabinet and pull a medication out. You always want to make sure that the order is very clear. If you're not sure of the medication and they give you a medical diagnosis, you can try to link that with the medication in your NCLEX question. Because in real life, you're going to look it all up in a book. But on NCLEX, you're going to have to kind of wing it sometimes. Look for commonalities in med names because there are certain drug classifications that have the same ending. The ACE inhibitors are the prils. The beta blockers are the olols. Some of the antibiotics are the mycins or the isins. So if you see that ending, but you don't recognize the rest of it, it's probably in that same classification that you already know about. So then you can look at and remember what the action and the side effects and everything else are for that drug classification. It'll give you a fighting chance. And then you can link the side effects with nursing interventions. When they ask you if you're giving a particular med, what do you need to assess for? For example, with a beta blocker, you know that a side effect of beta blockers is to slow the heart rate. So a nursing intervention would be to check the heart rate before you give the beta blocker. Look at a medication name, use medication terminology to help determine the medication action. So, any questions for me before we end?
That was really helpful.
Great, thank you so much.
So this is recorded and we'll be able to
Yes.
watch it again.
Yep, it'll take a while for it to go from Zoom into the cloud and finalize, but once I get the link for that, I will send it to your professors and they will post it on Canvas.
All right, thank you. Because I'm running on like very little sleep because I worked late last night, so I don't know how
no
much
problem.
I actually absorbed. So I definitely want to watch it again. All right, thank you so much.
Okay. Let me just see if we had another question. No.
Can we
Okay.
reach out can we reach out to you in any future point if we have any questions? Sometimes my questions come after the fact.
Absolutely.
Okay.
I am one of the tutors. And so your professors have placed the tutoring hours and how to get a hold of me, and you can certainly book a time slot in my office hours. And we can talk. I can clarify some content for you, or if you need to review after an exam because you haven't been successful on the exam, I'm available for that as well. Yeah, check and see if something in the chat. Oh, you're welcome. You're welcome. Anybody else? I'm gonna stop my
Another
screen.
question, sorry.
Sure, go ahead.
When, for example, this is going to be, I'm in Nursing 100 and we have the first exam coming up in a couple weeks. So there's a lot
Mhm.
to cover. So what is the best way? I'm sure you answered this, but just